Hello, everyone. I'm Congressman Al Green. I'm sorry we're starting a bit late, but it's been necessary because of technical difficulties that we've had. I'm honored to be today at a clinic that provides health care here in the Ninth Congressional District. I believe that clinics in our district are keeping hospitals from having to attend to patients that might ordinarily find a hospital as their first point of entry into the medical care system. These clinics are absolutely necessary, and they absolutely are helping men, women, and children, especially women, because about 48% of the childbirths in the state of Texas are covered by Medicaid. And Medicaid is something that is accepted here at this clinic. I would also add that in the state of Texas, we did not expand our Medicaid coverage. The state of Texas was offered $100 billion. That is correct. I said billion. $100 billion to expand its Medicaid coverage, and it did not do so because the state of Texas did not want to pay 10% of that $100 billion, federal government paying the other 90%. So we find ourselves with Texas being a state that has the most uninsured persons in the country, a state that has children that are uninsured at a rate that is about twice that of the national rate of uninsured children. So we need these clinics. They provide a valuable service. And I'm here today at the Ibn Sina clinic, and I'd like to just acknowledge some of the people who are helping children, pregnant women, persons who need health care. And these are persons who are not making the kind of money and don't have the type of resources that many people have in this country. There are persons who are not privileged with some of the opportunities that I have because they don't have the resources that I've been blessed to have. I'd like to acknowledge, if I may, Dr. Rapani. He is a chairperson. He is a very devoted person. I call him a doctor because he is a part of the healing process that this clinic has put into motion. And if Dr. Rapani is here, I'll point him out, but I don't think he is. Okay. Then we have the CEO, Dr. Shaw, who's here, and Dr. Assam, who is here. These are persons who have a hands-on experience with providing health care. I'm going to ask Dr. Assam if she's available to come over and just talk for just a moment, Dr. Azam, about the children who receive the Medicaid benefits that you have at the clinic.
So we have a children's clinic where we accept Medicaid for our children. We come here for consultation. They get vaccinated, and these vaccines protect the children from the diseases, and then thereby caring for them is very important. Getting the vaccine is very important, and if they don't, then they'll end up missing school, and it's a burden on the government. It's a burden on the parent. So I think it's very important for us to have.
Could you just mention measles because we've had in Texas an outbreak of measles?
Yeah, I think everybody should be vaccinated against measles, and if you have not, then it's definitely recommended to please go and get the measles vaccine.
And to this end, friends, I will be taking the test to see if I've been vaccinated. I'm not sure. I don't recall being told specifically that I was vaccinated for measles as a child, but I will take this test. It will let me know whether I have had the immunization for it. And if I do not, I'll come back at a later time to take the actual vaccination. Is that a fair statement, Dr. Baum?
Yes.
Okay, well, thank you, Dr. Baum. I appreciate you greatly. Uh, Dr. Shaw is here, I believe.
He's not.
Not here? Okay. Well, let me just continue with this question of measles. Friends, I'm encouraging you to have your children vaccinated. Uh, this is something that can prevent hospitalization, and in some cases, it actually saves lives. So I do encourage the vaccination of your children. And I hope to be a good example for you. If I find that I have not developed the immunization, then I will become a person who will get vaccinated, and I'll do it live so that you can see that I believe in what I say. Let me add this to this whole question of Medicaid. Medicaid is something that we have had available to persons who are living at or near the poverty line. And these persons are in need of this health care. Unfortunately, in Congress, we have required now, by way of a resolution that was passed, to have $880 billion cut from the committee that has jurisdiction over Medicaid. $880 billion. That committee cannot cut $880 billion from its budget without cutting into Medicaid. Medicaid will be cut if that $880 billion number is met. One of the reasons that I protested at the House of Representatives when we were having a joint session of Congress was because I knew about the $880 billion that was going to be cut from a committee that has jurisdiction over Medicaid. And I know that it will cause someone to not receive the kind of health care that they would merit if we allowed Medicaid to be fully funded. So I'm still of the frame of mind that we've got to protect Medicaid. I also mentioned Social Security, of which we'll have a shortfall in 2035. Not exactly on that at that time, but sometime near 2035, we'll have a shortfall, meaning it won't pay out as much as it's currently paying out. There will be payments made, but not quite as much. So we have to do something about Social Security. And of course, Medicare is something that we have to cover as well. Medicare can be linked to Medicaid when you have the dual eligible persons who are eligible for both Medicare and Medicaid. So we want to make sure that we protect these programs. These are the safety net programs that we have. And my taking a stand at the House has caused the nation to focus on these safety net programs. And this is important to note. We cannot sit idly by while these safety net programs are being not eviscerated, but they're being somehow lessened. They're being marginalized, if in some cases, if these cuts go through. And the cuts that are being proposed, while they appear to be cuts that will somehow benefit the coffer of the country, the truth is we're also planning to give a huge tax break to persons who are high income earners. So low income people who would get Medicaid will now see the Medicaid cuts, and high income earners will benefit from the cuts to Medicaid. And that kind of shocks the conscience when you think about it. It would seem to me that we have a moral imperative to do what we can to help people who are not as fortunate as the billionaires who may receive some tax breaks as a result of Medicaid being cut. But I still stand today where I stood when I was in the House of Representatives, took to the floor. I did interrupt the president, but I did it for reasons unrelated to Al Green personally. I did it because there are people who will suffer, and the president needs to hear from people who are willing to tell him the truth. The president surrounds himself with people who are going to say, yes, Mr. President. They have such respect for him. They are in awe of him to the extent that they will not take a stand and say, Mr. President, this is something you should not do. I happen to be the person who will tell the president the truth. So, Mr. President, I still stand on truth, and I trust that you will understand the necessity to maintain Medicaid, Medicare, and Social Security as safety net programs. I'm going to close now because I'll take my test to determine whether I have I have the vaccine. I've been vaccinated properly, or I've had measles, one or the other, such that I can show that I have been immunized for measles. And if I have not, then I will, of course, come back and actually take a measles vaccination. I believe in what I say, and when I do, I try to lead by example. I want to thank all of you for taking the time to hear this event. And if there are members of the press on and you have a question, we would gladly welcome your calling your question in now as we are coming to a close of this part of our event. All right. I don't think we have any questions from the press. Well, thank you to members of the press as well for what you will do to get the message out so that we can save as many lives as possible. I am encouraging people to get vaccinations and get their children vaccinated. This can not only help the person who gets vaccinated, but it takes a lot of the pressure off of hospitals when people aren't vaccinated or they get hurt and they have to go to the hospitals. These clinics take that pressure off because you can get vaccinated here and avoid having to go to the hospital at a later time. I'm a full supporter of clinics such as this one, and this one does an outstanding job. It serves people of all ethnicities. It is available to people for no cost most of the time, and Medicaid covers costs some of the time. But it is a clinic that is here to help people who need services that they might have to go to a hospital to acquire because they don't have insurance. And it is very expensive to go to a hospital. It is much better to come here and much better overall to get proper vaccinations so that you don't have healthcare issues in the future. Thank you, everyone. And I will talk to you again in the near future. Bye.